Hello, everyone. Welcome to today's presentation on First AID. I'm excited to have you all here. Over the next few minutes, we'll explore the essentials of providing immediate help in emergencies. We'll cover basic techniques, important precautions, and how to stay calm under pressure. Let's get started and learn how to make a difference when it matters most. Let's start by understanding what first aid really is. First aid is the immediate care given to a person who is injured or suddenly becomes ill, and this is done before professional medical help arrives. It's about providing quick, effective assistance to stabilize the person's condition. The main goals of first aid are to preserve life, prevent the injury or illness from worsening, and promote recovery. This is a crucial part of our overall safety and health awareness, because knowing how to respond in those first critical moments can make a huge difference. Remember, in emergency situations, every second counts, and being prepared to deliver first aid can save lives. When it comes to basic principles of first aid, the first thing I want to emphasize is to preserve life. This means ensuring your own safety first, and then doing everything you can to prevent the person from dying. It's the top priority because without life, nothing else matters. Next, we need to prevent the condition from getting worse. This involves actions like stopping bleeding, protecting wounds from infection, and supporting fractures to avoid further injury. These steps are crucial because they can make a big difference in the person's recovery. Then, we focus on promoting recovery. This means providing comfort, reassurance, and the right care to help the person stabilize and feel safe. A calm, reassuring presence can be incredibly helpful during a stressful situation. Finally, seeking medical help is essential. We should arrange for professional medical care as soon as possible because trained medical personnel have the skills and equipment to handle serious injuries or conditions properly. Together, these principles form the foundation of effective first aid. They help us act confidently and responsibly, always keeping the overall goal in mind, saving lives and supporting recovery. Let's take a closer look at the scope of first aid and where it can be applied. At home, common incidents like cuts, burns, falls, and even poisoning can happen unexpectedly. It's important to know how to respond quickly to these situations to prevent further harm. Moving to the workplace, first aid skills are vital for accidents, fainting, and electric shocks that might occur in that environment. Being prepared can make a real difference in managing emergencies effectively. On the road, we often see traffic injuries, fractures, and bleeding, especially in busy or accident-prone areas. Knowing basic first aid here can help save lives and reduce complications until professional help arrives. During disasters, such as floods, fires, earthquakes, or explosions, first aid becomes even more critical. People can be injured or trapped, and immediate care can be life-saving in these chaotic situations. And in sports or schools, common injuries like sprains, bruises, or nosebleeds happen frequently. Quick first aid responses help minimize pain and prevent further injury. Overall, this scope shows how versatile and essential first aid knowledge is across various environments and emergencies. It's about being prepared to act swiftly, safely, and confidently wherever you are. Now, let's talk about the rules of first aid. First and foremost, it's crucial to stay calm and act quickly. Panicking won't help anyone and can make the situation worse. Next, always ensure your safety and the safety of the victim before proceeding. You can't help if you're in danger yourself. Once it's safe, check the victim's responsiveness, airway, breathing, and circulation. These are often called the ABCs. These checks are vital to understand what immediate actions are needed. Remember, do not move the victim unnecessarily, as this could cause further injury, especially if a spinal injury is suspected. Reassuring the patient and providing comfort can make a big difference in helping them stay calm and cooperative. If the situation requires additional help, don't hesitate. Seek assistance immediately. Acting promptly and following these rules can make all the difference in providing effective first aid and potentially saving a life. Let's go over first aid management for wounds, hemorrhage, and shock. When someone has a wound, the first step is to clean it thoroughly with antiseptic to prevent infection, and then cover it with a sterile dressing to protect it from dirt and bacteria. If there's bleeding or hemorrhage, the key is to apply direct pressure using a clean cloth. This helps slow down or stop the bleeding. Elevating the affected limb can also reduce blood flow to that area, which helps control bleeding. If necessary, and if you are trained to do so, you can use a bandage or even a tourniquet to really control severe bleeding. Now, if the person goes into shock, the priority is to lay them flat on their back and raise their legs slightly. This helps improve blood flow to vital organs. Keep them warm and reassure them to stay calm, as anxiety can worsen the situation. Remember, do not give them anything to eat or drink, as this could cause complications if they need surgery later. And of course, always call for medical help immediately. These steps are crucial because they can significantly improve the victim's chances of recovery before professional help arrives. When it comes to musculoskeletal injuries, understanding how to respond quickly and correctly can make a big difference. Let's start with fractures. If someone has a suspected fracture, the first thing to remember is, do not move the limb. Moving it could cause more damage or pain. Instead, immobilize the area with splints, making sure to keep it as stable as possible. Then, support and transport the person carefully, avoiding unnecessary movement that could worsen the injury. Now, for dislocations, the key point is support. Support the joint, but importantly, do not try to push it back into place yourself. Attempting to do so can cause further injury. Instead, seek medical assistance immediately so professionals can handle it safely. Lastly, muscle injuries often involve strains or sprains. The best initial response is applying rest, ice, compression, and elevation. Rest the injured muscle to prevent further damage, apply ice to reduce swelling, use compression bandages, and elevate the limb to help minimize swelling and pain. Throughout all of this, remember that proper response to musculoskeletal injuries is crucial in minimizing damage and ensuring the best possible recovery. When transporting injured persons, it's crucial to keep the spine, head, and neck in proper alignment at all times. This helps prevent further injury, especially if there's a potential spinal injury. Use stretchers or improvised supports, things like blankets or boards, so you can move the person safely and securely. Always avoid unnecessary movement. Every move should be deliberate and careful to protect the injured person's spine and overall condition. Before you start moving someone, make sure their airway is clear. This is critical to ensure they can breathe properly during transport. When lifting, use correct body mechanics. Bend at the knees, keep your back straight, and lift with your legs. This not only protects your own body, but also helps you move the person more safely and efficiently. Remember, the goal is to keep the injured person as stable and comfortable as possible, while minimizing the risk of additional harm. This approach aligns with our overall focus on safe, effective rescue techniques. Now let's talk about respiratory emergencies and basic CPR. The first step is to always check the airway, breathing, and circulation, or ABC for short. This helps us quickly assess the person's condition. If you find that the person is not breathing, it's crucial to start CPR right away. Begin with 30 chest compressions to keep blood flowing to vital organs. After that, give 2 rescue breaths to provide oxygen. It's important to continue this cycle, 30 compressions, 2 breaths, until professional help arrives or the person starts to recover. Another key point is to ensure the safety of the scene, especially by checking for any choking or obstructions that could be blocking the airway. Removing such obstructions can be life-saving. Remember, quick and confident action can make all the difference in a respiratory emergency. Now let's talk about unconsciousness. The first thing you want to do is check responsiveness and breathing. Gently tap the person and ask if they're okay, while also watching to see if they are breathing normally. If they are breathing, the next step is to place them in the recovery position. This helps keep their airway open and prevents choking if they vomit. However, if they are not breathing, you need to start CPR immediately. Every second counts, so don't delay. Remember to keep the airway clear, remove any obstructions if possible, and loosen tight clothing around their neck or chest to help them breathe more easily. These steps are crucial because they directly influence the person's chances of recovery. Always stay calm, act quickly, and follow these key points to provide effective help. Let's talk about foreign bodies and how to handle them safely. When you find something like a splinter or debris in the skin, the best approach is to remove it carefully with clean tweezers. It's important to use sanitized tools to prevent infection. If a foreign object is in the eye, never rub it. Instead, rinse the eye gently with clean water to help flush out the irritant or object. Rubbing can cause more damage or push the object further in, so gentle flushing is the way to go. For foreign bodies in the ear or nose, do not probe or try to remove them yourself if you're not trained. Forcing or probing can cause injury or push the object deeper. Instead, seek medical help to ensure proper removal. Now, if something is stuck in the throat or stomach, the priority is to encourage coughing if the person is choking but still breathing. If they're choking and cannot breathe, perform the Heimlich maneuver immediately. This can help dislodge the object and restore normal breathing. Throughout all these situations, the key is to act calmly and carefully. Proper handling of foreign bodies is essential in first aid because it can prevent further injury and ensure the person gets the appropriate medical attention quickly. When dealing with burns and scalds, the first step is to cool the affected area. I recommend using running water for about 10 to 20 minutes. This helps reduce the heat and prevents the burn from worsening. It's important to remember not to burst any blisters that form, as they protect the underlying skin and help prevent infection. After cooling, cover the burn with a clean, non-stick dressing to keep it protected. And finally, if the burn is severe, involves the face, or if you're unsure about the severity, seek medical help immediately. These steps are essential to managing burns effectively and minimizing long-term damage. Let's talk about poisoning, bites, and stings, which are common emergencies in outdoor or unfamiliar environments. When someone has been poisoned, the first step is to identify what the poison is, because that helps determine the best course of action. It's very important not to induce vomiting unless you're specifically instructed to do so by a medical professional, as some poisons can cause more damage if vomited. Keep the victim calm and as still as possible, because movement can speed up the absorption of the poison. Then, seek medical care immediately, don't delay. Now, moving on to bites and stings. These are often from insects, spiders, or even snakes. For any bite or sting, start by washing the area thoroughly with soap and water to reduce the risk of infection. Applying a cold compress can help decrease swelling and pain. If someone has been bitten by a snake, immobilize the limb to slow the spread of venom. And of course, get the person to a hospital as quickly as possible. It's always better to be safe and get professional treatment promptly. Remember, quick and calm action can make a huge difference in these situations and improve the chances of a good recovery. Let's talk about frostbite first. If someone has frostbite, the key is to move them to a warm area as quickly as possible. Once you're there, gently warm the affected area, but do it gradually. Using body heat or warm water works well. It's very important to avoid rubbing or applying direct heat, such as a heater or hot water bottle, because that can cause more tissue damage. Now, shifting to the effects of heat, we need to be aware of heat exhaustion and heat stroke. For heat exhaustion, the first step is to move the person to a cooler place and encourage them to hydrate with fluids. It's a warning sign that the body is overheating, but hasn't reached the critical stage yet. In the case of heat stroke, it's a more serious emergency. You should apply cold compresses to help bring down the person's temperature and seek emergency medical help immediately. Recognizing these signs early and acting quickly can make a big difference in preventing serious injury or complications. Overall, whether dealing with cold or heat-related issues, the key is prompt and appropriate response to protect the person's health and safety. Now, let's talk about community emergencies. These can be natural, like earthquakes, floods, fires, and storms, or man-made, such as accidents, explosions, and chemical spills. Both types can happen unexpectedly and require us to be prepared. As first aiders, our role is crucial. We need to provide immediate help to those affected, ensuring their safety and comfort. Calling emergency services promptly is essential so that professional assistance can arrive quickly. It's also important to prevent panic among the crowd. Staying calm helps maintain safety for everyone. In many cases, we might need to assist with evacuation or triage, helping to prioritize who needs help most urgently. Remember, being prepared and knowing your role can make a significant difference during these emergencies and help protect our community.